Hello, this is Dr. Bo Ellis, and I'm doing a video in regards to the book that I recently wrote. The title of that book is What You Should Know Before Having Disc Surgery. The subheadline of that book is 7 things that you can do to heal and strengthen your disc so you don't need surgery. Anyway, I just wanted to do a little demonstration because in that book I talk about traction. And one of the best tractions is a real light traction. There are a few things in that book that I do not cover as far as an inversion table and some of the other ones. But this is one of the easiest things that you can do at home on your own. You don't have to have a table quite like this. This is a specialty table for chiropractors in general. And actually here, before I end up showing you what I'm going to do, I'm going to get the paper cleaned off so I can lay down for a second. These here are the pellet blocks that I mentioned in the book. So you can either buy these chiropractic blocks or you can buy cheaper ones that are just, high density foam and save a lot of money. They just won't look as nice. Anyway, what you want to do is make sure that the table that you have, whether it's a massage table, that would be fine. It has to be something that's firm. It cannot be your bed. It cannot be a couch or anything. The floor, maybe, possibly. They do have, I know I have one. It's a portable kind of a headrest, and basically it's just 2 cylinder pads that you can, put right up on your cheeks so that your nose isn't smashing against the floor and you can relax in that position. Otherwise, you have to turn your head to the left or to the right and then keep changing the position of your head so you don't create yourself a neck problem. Anyway, these blocks will go under the pelvis here, right underneath these bones. So you just got to get in here and kind of squeeze around a little bit. Find the very top part of the bone near the outside. Okay, and it's just where these muscles here that come up, the sartorius muscle comes up and attaches right to the superior iliac spine, which is right here at the top. Anyway, find these bones right in here, and then what you want to do is you're going to put these blocks once you lay down, and you're going to slide them in like that, okay? And you want to get it the highest portion of this block right in on that bone. These are wedge shaped because you want blood to keep flowing through here. All right, you have a lot of blood vessels, the iliac artery and stuff flows down through here to the femoral artery and so forth and goes down in through the leg. If you compress that, your legs are going to fall asleep. Okay, you don't want to do that. If you leave those asleep for half an hour, you'll probably end up with a neuropathy, or you might not be able to get up off the table after you're done. It's kind of like sitting on a toilet for a few minutes. You sit there for too long and you can't get up, right? So your leg goes to sleep. Anyway, the same thing will happen to your entire leg if you do that. So the best thing to do is to kind of measure yourself out on the table. So I've already have an idea for how tall I am and stuff, but you get on the table, lay down, find out where those bones are, and get into a good spot that's going to work for you. So for me, right here at the edge of the table is right where that bone is. I can go a little bit lower if I want to, and I'll probably stay right about here. That's pretty comfortable. I've got room for my head and so forth. With this table, one thing that's really nice about it is the stomach portion, which doesn't matter for me so much, but for some people who have a stomach, it's nice to have a drop piece that kind of goes out of the way. And another cool thing about this table, not that anyone's going to run out and buy one, but just to kind of give you an idea, like here, this, you can lower it, you can, raise the height of it, and so if you have a stomach as well, or if you're pregnant, you can raise this up and leave more room for the stomach. Anyway, so you kind of measure it out first, set these down. You can always adjust them once you lay down. It's just more difficult to do so. Anyway, this provides a real light traction, and then you can just basically take a nap, for 20-30 minutes. I recommend 30 minutes if you have the time, and breathe in, breathe out. Get some nice deep breaths in, because every time you breathe, your breath is initiated in your sacrum. So You know, right down here is where breath starts. It works its way all the way up to spine, all the way to the top of the neck, and then your rib cage and everything opens up. All right. It's really important to do that because that adds a little bit of movement and motion. It helps the neurology, the muscles, the joints kind of settle in and relax a little bit, besides getting more oxygen to the tissues, which will allow them to relax more as well. So, all right. So I'm just going to lay down on these and make sure that these are working all right, and that there's a little bit of room, you know, for my stomach to kind of hang a little bit. All right. So I just have to push these in a little bit now, because they're at the right spot, so that's perfect. Right there. And that's all I really need. I've got my chest pushing down on this a little bit, and I'm free hanging. There's nothing in between my belly button and basically the table. It's all open right there. So I can just relax now, and I can breathe. Anyway, I know you don't want to watch me relax for 30 minutes, so I just want to point out here, if I wanted to, you know, to increase this, I can roll this a little bit, but you don't need much pressure, much traction, much force. You know, some people like to overdo it. They think more is better, and it's not always. If you have an injured, torn disc, then you definitely don't want to, you know, end up hurting yourself. You know, because if you hang upside down, you know, on something, either your feet are in boots and you're upside down, or you're on an invertrack type table, you're going to end up having too much pull and pulling apart of that disc, and those weak, half-torn fibers are going to tear more, and the surrounding tissues are going to take more of the force, and you might actually end up injuring those as well. So it's good not to do that. You want a nice, slow rehydration of the disc to get it to plump up in all aspects of that disc, not just the back portion of it, the whole disc. And once the whole disc gets hydrated, then the healthy portions of that disc will help support your weight and the compression throughout either the rest of the day, and you'll be a lot better off. Anyhow, if anyone has any questions, please feel free to comment or you know, send me some questions. I'll be happy to answer them. Let's see. One main thing that, you know, people don't realize is that when you wake up in the morning, you're a little bit taller than you are before you go to bed, and that is because the discs in your spine, they contribute to about 1/3 of your height of your spine. Okay, so if you're like the same height I am, you'd lose about this much total if all of your discs completely just disappeared. All right, and that would just be awful, terrible. Most people lose 1 inch to 2 inches throughout the day because of constant sitting, you know, standing. Sitting is the most compression on the spine. Not talking about exercise or lifting things like that, but if you're just sitting versus standing versus laying down. Laying down is the least amount of pressure on your spine, which is why at night, as long as your muscles are relaxed, they will rehydrate, and then by morning, you're a little bit taller than you were when you went to bed. All right.